Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation.
Hello.
Hi.
Hi. Welcome back. We are excited for this next episode. We are going to wrap up our series we've been doing on the fertility certification we've both been working on. Tonight, we're going to talk about kind of the manual techniques that we as the PTs are going to be providing in a session. So we've talked about the endocrine system and hormones and nutrition and sleep and all those things that we are going to be assessing. But then, it bears the question, okay, but what are we actually going to be doing hands-on? So we're going to kind of talk about that tonight, which will be fun. And we can share a little bit as into what happened in our own experiences when these techniques were performed on us, which is fascinating. But to get us started, we're going to start with our usual, or tell us something good. So Roxy, you start.
Okay, I will. Something good. My grandma turns, I think it's today, 98. We celebrated her birthday last night and just did homemade ice cream and a little dessert. And she just is so sweet. And so anyway, it was just kind of fun. She's just at an interesting age too, where, I think about, if I get to 98, like probably all my friends are going to be dead, and then you may have a new round of friends, and she's talked about like old friends and I don't know, it was just really kind of a sweet moment though. She's like, I just love this. A lot of like now she's in like a kind of assisted living type place. And she's like, a lot of the other people don't have family like this that like celebrate them or come and see them. And so it just was like really sweet. And I asked her, what was your favorite or birthday gift or celebration or memory? And she said when she was little, her neighbor gave her a little, is it a Bantam chicken?
Oh, yeah. They're like the little chicken. Yeah.
And then like they had a handful of little chicks. And she said she was like maybe 10. And she said that's my favorite birthday memory. And so it just kind of made my heart smile. But yeah.
That's so great.
Yeah.
What a life. I always love talking to people that are that age because just like they've seen so much life and so many things change.
Sidebar, she like lived in the panhandle of Oklahoma. So she was like in the thick of the Dust Bowl. And we like asked her questions. And she was like, oh yeah. Like it's just like kind of like no big deal. She's like,
no big deal.
She's like, we always had food to eat and, we made it. Like, just like, yeah. And so it just is kind of fascinating.
That's so sweet.
The petty worries that I have every day. And then like, they're seen so much more. So, yeah.
And also it's like, they really know like not that we don't know what hard work is, but like they really know hard work is and sacrifice. So that's really cool. Okay. Mine is so, I don't know, for all you MLB lovers out there, with baseball lovers, the home run derby is tonight and the night that we're recording this, it's Monday. And then what is it? The All-Star game is like tomorrow night or here the same week. And my son, Owen, is obsessed. And my husband has been working on getting the garage cleaned up. And we had an old TV in our basement that he took out and hung on the wall out there. And my son is just like obsessed with his dad right now and like wants to match and all the things of like when they were baseball gear. And so I said, well, you can make it like your little man cave in the garage. And so he told Owen that, and Owen's all about it. And I got home tonight and they had the home run derby on and they're both sitting there in the heat, both just sweating and watching the home run derby. And it just made my heart happy to see them spending time together and, just good bonding time.
That is funny. That's man time right there. Sweating in the garage watching
man time.
TV.
And it's just funny the way Owen talks now. He'll be like, he's really like into right now figuring out like what makes you a man. So
Sweating
yeah,
makes you a man.
yeah. And he'll be like, when I'm a man, I'm going to have da 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 da, you know? And then the other day, his words in the car, he said, Mama, did other men like you before you started dating daddy? And I just thought it was so funny the way that he asked that question.
Other men.
Did other men like you? I said, of course, because I was the bomb. Oh, we all laughed so hard. Anyway, so all right, back to it. Well, let's chat about what our role is, what we do manually, and then share a little bit about as we go, like our own experience, because I know we both had our own experience with this. So to start us off, one thing that Yenny taught us, which she learned from her training, is something that a technique that's referred to as kind of local listening. And that's really just a technique that we can do where, you know, our hands as therapists, we use our hands a lot, and we learn to be able to almost like close our eyes and feel the tissue and restriction that might be there. And so that is just a technique for us to just be able to put our hands on your abdomen, lower abdominal region, through the rib cage, and just kind of like let you breathe and let us feel what's going on. And a lot of times, I mean, I know that for myself, I can do this in a sense where you might be kind of telling me something or talking, but like I'm very much intentionally, someone might be like, what are you doing? But I really am assessing to feel. So,
yeah, it's a very different type of, I think, hands-on of just like she said. Yeah, I think a lot of times when we think manual therapy, I think specifically like active. What am I doing to the tissue? And this is very different of just saying like, okay, let's kind of feel, and not in like a weird way, but just like, let's feel what's going on here in this tissue. And like, is it tight? Is your body letting us be right here? And just really kind of vibing off of what your like abdomen and skin are doing. But it's just a very different thing. Like, yeah, it's like, I almost like sometimes before when I like, as I'm getting used to it also is just like, this is different. What's someone thinking? Like it, you know, it's because it's so different than when I'm working manually on them. Otherwise, I guess I should say like on muscle.
Yeah. And I think too, just even that term manual therapy, a lot of people are kind of like, well, what does that even mean? And I think that like for a quick answer, people think like, oh, that's like you cracking my back type of thing. But it definitely can have different meanings. So yes, I think in the sense of when we're doing just kind of some local listening to your body, it's not something that we're trying to necessarily manipulate anything.
Change,
We are really just kind of seeing, and this is where that whole, like a lot of times people will say to us as PTs, like, you always know the right place to find. How do you know that? And it is something that comes with time and skill to be able to feel. And it takes some experience to be able to, you know, be on an area and nobody saying anything, and to be working and to be able to look at your patient in the eyes and say, does that hurt right there? And they're like, yeah, that's exactly what I feel. And they didn't give on at all that anything was hurting, you know, and that's just from our feel to be able to tell, we can tell where the restriction is. So anyway, so we kind of start with that. And then from there, you know, this doesn't necessarily in this order, but it really is good to start to be able, because that's kind of that first assessment to see where the area is that we know we're going to be working on. And then going into lymphatic drainage. You want to talk about that, Roxy?
Yeah. So this is a good place to kind of start some like intervention. So local listening is kind of for us to feel, and it's almost like the assessment part. But then from there, you know, we kind of move into more like treating, I guess you should say. And so this then is where we can move the lymphatic fluid around, especially if there is quite a bit of inflammation, and not like swelling inflammation, like not like bloating inflammation necessarily. It could be, but just inflammation in the tissue that would be causing some restriction. And so to work on different lymph nodes and then be able to just kind of clear the area. A lot of times we kind of talk about it in that terms of we're going to clear the area of just some of that excess swelling, or not swelling, but like fluid.
Cellular waste.
Yeah. That's just kind of sitting there because of whatever, you know, if there's restriction and it can't get out, or if there just isn't good mobility. And we'll talk more kind of about why mobility is important. But if there's just not good movement in the area, and you think about when you're not healthy, or, if we really just take even sickness, we might curl up in a ball, in our bed or whatever, and our body isn't healthy. It doesn't just want to like get up and dance and move around really well. And our tissues then kind of do the same thing. So we want to access help make the best environment for that movement. And so we clear that area. The lymph nodes in the abdomen, around the umbilicus there, and then like inguinal. They're all over our body, but obviously when we're working with a fertility patient, that's kind of the area we're focusing on.
Yeah. Not to mention, it feels pretty good too. It's just one way to kind of like let the body kind of come down a little bit. Some hands-on. I mean, I find it feels very nice to have those abdominal lymph nodes kind of drained. And I like to say it's kind of getting the sludge moving and getting things flowing, venous return, all that kind of stuff. So yeah, so the lymphatic work we can go through, and pretty much, I think next, one of the main things too that we assess and we're taught to assess is the peritoneum. And the peritoneum is a deep membrane that is like smooth tissue that lines your abdominal pelvic cavity, and it surrounds your abdominal organs. So in order to assess the peritoneum, it's very deep. And so with that, we do have to do some pretty solid engagement of letting our hand kind of sink into the abdominal cavity. And once we're there and we're deep, that's when we can kind of slide and like move our hand a bit to see, okay, where's that restriction? And I'll tell you what, it doesn't take much. Well, first off, some people can't even let your hand in. And Roxy and I'll talk about both of our experiences with that. So it takes time. Once you're able to honestly like get your hand deep enough, it sometimes doesn't take much movement at all. And someone will say, oh my gosh, I feel that across my body up into my, side of my neck, if you will, because that's where that whole body approach comes into play. And this is why I know for myself, and probably you too, Roxy, this is one of the reasons why, to me, not seeing a pelvic health patient or a fertility patient or somebody like, in this space for an hour, it's just not acceptable. We need to have time to do this, because if you see somebody for 40 minutes and they come in and you take a good assessment or a good subjective and you're asking them your questions, and let's say they have to unpack a few things, and let's just say that takes anywhere from, 7 to 10 minutes, then you have 30 minutes. 30 minutes is all you have to treat the pelvic floor, the nervous system, the abdominal wall, potentially breath work, adductors, like it goes on. So I'm on a segue there, but I think the purpose of this is like, this stuff takes time, because it can take a good solid 10 minutes just to get somebody to breathe and let your hand in. So, and I know this is hard because you don't have a visual. Okay, so Roxy, so tell us about your experience. So you and I were partners at different points. We were partners, we switched around. But that peritoneum work, you place your hand on somebody's abdomen and we do what we call breathing the hand in, if you will. So I have Roxy take a good breath in, exhale. And as she exhale, I put pressure down through my hand and I push through the abdomen and let my hand sink in. And then when I feel like I have to stop, I have her take another good breath in, and then I follow my hand down even more. And Roxy, tell us about your experience with that.
Yeah, not comfortable for me. I was very tender on my right lower quarter, kind of like in front of my right hip, I guess you could say, and just sensitive. Like every time we do something, it's like I was anticipating that to hurt. But at the same time, I know, because I'm learning it, I know that it needs help. Or that it needs to happen.
Yeah,
and so it was,
yeah.
Yeah. So it was tough to like relax
Yeah.
because I was anticipating pain, but I wanted the treatment. Like I wanted her to learn, but I also wanted to experience the benefit of getting to those deeper layers. And man, that was like all day. It was just that right lower quarter was real tender.
Yeah. Yeah. I remember she said to me, like, I don't know why I can't like let your hand in. And it was like I was hitting a brick wall. But that wasn't the first time that I had experienced doing that to somebody. And that's what it felt like, because I had previously been doing this on patients from the summer before. And so I was like, oh yeah, like this is something, that I've come across, and it takes time with people for them to be able to slowly, to me, it's like kind of like if you have an elbow surgery and your elbow's swollen and you're getting ready to start having movement there, you do little by little. And each time you go back, you trust your therapist more, your tissues start to relax more. And so it's that same thing, but like deep through the abdominal wall. And I think there's the takeaway with that is it shouldn't be that painful and it shouldn't be that guarded. And so it's just like Roxy said, it's like you want to be able to allow that to happen because you know you need it. So I myself, when that is being done to me, I did not have as much of a response as you did. Mine was more ovary related, which we'll talk to about that, but because we both had ovary issues when we did this stuff. But yeah, it's fascinating. And I just was working on somebody today, and it didn't take much for my hand to be brought into her peritoneum. And she was like, oof, that is tender today. And it didn't take much. And she had a visceral response, like her stomach kind of felt a little weird and, all that kind of stuff. So anyway, it means we're doing something to the body. So yeah, when we're doing that, we're like engaging fascial gliding with that, the fascia, peritoneum, everything should slide and glide. And then when that's not happening with our organs, that is one indicator when we're having that restriction that there's potentially not quality movement happening between the organs, which can potentially be causing like lack of blood flow, that sort of thing. So far, we are listening to your abdomen with our hands, draining your lymph nodes, and you're breathing our hand in. Okay, so like that's the assessment. Talk to us, Roxy, about kind of that peritoneum treatment.
Yeah. So basically when we have kind of found restriction, then we're working into that restriction. And basically what we want to do is when we feel like there's tension there that is asymmetrical. So we're kind of looking at, oh, that feels tense, but let's see what the other side's doing too. Or like, let's see how the tissue around it is moving. Then when we find that restriction, then we're going to work into it. We're going to try to just really, it's like that same deep pressure, but it's like a long kind of almost considered a stretch is kind of how I picture it. Of we just have that real deep pressure into the peritoneum there, and then we put it on stretch and tension for a longer hold. I mean, if we really get nerdy about it, like really we're helping the brain like feel that. We're helping the nervous system say, wow, that doesn't move well. That's not healthy. Megan and I like physically aren't changing people's body or that tissue necessarily. Like really, if we think about it, we're facilitating the body to kind of identify these areas and to correct it itself. But that's essentially what we're doing is we're just seeing that deep tissue. We're going past the skin, past the fat, past the muscle. Like we're going into lots of layers that are really deep and getting clear down to the organ level. And then we're taking the tension there. We're trying to just create better mobility throughout that tissue. And we have to kind of have a longer hold to do that. So the brain can say, oh, okay, this is what needs work. This is what needs fixed.
Let's accommodate. Yeah, exactly. Such cool stuff. Yeah. So that is the peritoneum is one thing. And then mobilizing the uterus itself is another. So you can mobilize the bladder, mobilize the uterus. I mean, there's all sorts. I mean, there's further visceral work of GI and urinary and all that stuff. But this was strictly like fertility. So we're thinking reproductive organs. So bladder, uterus, ovaries, and being able to find the borders of the uterus with good practice. And this is something that takes time and experience to be able to tell if somebody's uterus might be retroflexed or anteverted, that sort of thing. And that is something that like Roxy and I were you're like, okay, you really have to almost like close your eyes, feel the borders. And it takes practice to do. But the mobilization of the uterus, I know both of us have already experienced. If you have somebody that has had like a chronic inflammatory disease or process like endometriosis, adenomyosis, fibroids, painful periods, PCOS type stuff, it is incredibly uncomfortable to first have your uterus mobilized. But good golly, like there's so much improvement you see with people, especially, I don't know about you, Roxy, but one thing is, regardless on if somebody is fertility or not, people with painful periods, this is one of the tools that can be used. And how it's so cool to watch people like have like their cycles as we are seeing them. And they're like, you know what? I didn't have that right or left lower quadrant pain like I normally do during ovulation. Or, you know what? I barely had any cramps this time. And it's just so cool. That for me is just when one of like here recently, something that I just really have loved to see happen, because it's so great to be able to help somebody that has dealt with something for so long and you don't think you can help. Like everybody has painful periods, thinks it just is what it is. So anything with that, Roxy, with uterine mobility that you noticed?
Well, I just think if we just think about our body, like our body really wants to move. And really that's, I mean, I know we talked about that with the peritoneum, but just that idea of like when it doesn't move well, there's always going to be some kind of problem, and it may not be symptomatic right away or whatever.
Right.
And so really like we are just trying to restore the body to how it was created to function. Like we're just trying to help identify areas of restriction. And so that then we have good movement. And people might say, well, why do you need that? You know, like, why do we really need our uterus to move? Well, the bladder sits right next to it, and our bladder constantly fills and empties, right? So if the bladder's, if the bladder is moving on the ovary or on the uterus, sorry, and the uterus is stuck, then all of a sudden it throws a lot of things. Or if we think about our bowel movements, just like there needs to be such like just good mobility through those organs, because they're constantly filling and emptying a lot of them. And there's just movement. And even just like thinking about walking or reaching, like their trunk movements, this is all just really functional. Like, why would we not want to move that? If someone's like, yeah, my shoulder's kind of stiff, but it's okay. Like, oh, if you can't, if it's stiff, then it's going to just keep getting stiff because it's not going to get used and it's going to get weak. And it's just like a ripple effect. So really, if we just look practically, whether it's a fertility patient or just like she said, someone with painful periods or whatever, like, why would we not want that area to be healthy anyway? So I don't know, that's just kind of like a big picture thought of like, what's the point? Well, why wouldn't we? Like, how isn't it though? How isn't it a point?
Well, and I think we see too, like on our end, like we have people coming in with dysfunction, but you even think about like abdominal surgeries. And when I say abdominal surgeries, that means and is considered a C-section. So C-section scars of how low that is, like your bladder and your uterus, everything is right there. Often scar mobilization is not talked about post C-section ever. And so if luckily now hopefully somebody might come across it while they're late night scrolling up with their baby. But that's where we really do recommend. I mean, that's one of the things of like why we want to do that is because it's not just that we want to get the scar to move and the tissue to move, but we're also thinking about those organs behind there too. Because scarring, when that lays down and any adhesions lay down, the effects that can have, it's like a ripple effect throughout the body. It's like when you throw a rock into the water and you just see those ripples go out, 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 out. Where that rock hit might be right where that adhesion is, but it can affect things so far away. So really, and if you look at a model and you see, like Roxy just said, where the bladder is and the uterus is and the rectum is and how they lie so nicely together, you really do want them to be moving. And I remember one thing that Dr. Yenny had mentioned when the first round, when I took one of her trainings, was an organ that doesn't move well. Eventually, it quietly starts to not function quite like it should. We're not going to know we're not going to have any symptoms. It just quietly over time until it gets to a point where then suddenly you have symptoms. So something to just kind of keep in mind. But so from there, we can kind of look at like broad round ligament assessment and treatment. That's something that is kind of, we've been trained on prior to, but we can do some work and mobilization through there. We talked a little bit about bladder mobilization, which again, fertility wise, it's just the bladder is right there. Sometimes people also have bladder discomfort. That's something we do with a lot with like our interstitial cystitis patients, that sort of thing. And then ovary assessment, the good old ovaries. They are very hormonally dense. We both had experiences with that.
Yes, we did.
Yes. Okay. Tell us, Roxy, how about you lead us off, just kind of telling us about finding the ovaries, mobilizing them, and then we'll talk about our experiences.
So Usually people have two ovaries. And so, and they aren't always symmetrical. So when we find these ovaries, sometimes the one's higher than the other, sometimes one's deeper than the other. And so anyway, that's just kind of a fun fact. It's not symmetrical like the little models show. And so, yeah, we would like to find these and mobilize them, because when we mobilize and stimulate them, that's actually can be stimulating. Like when the ovary is stimulated, like Megan said, it's a hormone dense little organ there. And so that can stimulate then your hormones too, to try to reset, whatever, we're kind of doing, or we're trying to just help everything get a little more on track, obviously. I mean, we want mobility of those ovaries as well. Again, just if we think about the egg being released or the follicle being released and then meeting up with the sperm, we don't want there to be restriction or any like trouble there. But also we can, by just stimulating that ovary, we can help try and balance out a rhythm that may be chaotic.
Yeah. Well, and I mean, they're like the size of our ovaries are the size of a nickel or an almond. They're so small. And again, we have people that come in with quote unquote ovary pain quite often. And, especially if you've had PCOS or constant kind of inflammation around that ovary and there's not that movement, again, that's where that mobilization can become very helpful, increasing blood flow, all that. The ovaries are the one part of this that don't sit inside the peritoneum. So they're kind of like free moving around. And that's why they can be in like totally different spots. And it's kind of fun to see. Like we have like a idea of like of landmarks we go to kind of see, okay, they're going to probably be in this window or in this space within the lower abdomen. But now it's like, I think we called it like ovary hunting when we were at the course. Like, okay, let's find your ovary. But I know for myself personally, when I went to this course the first time, I had a lot of anxiety about this the second time around going to that course. I think I let Roxy go first on my ovaries, but it's primarily my right. I believe I probably had my hand around your wrist because I was ready to like stop you. But my first time, I have a long history of ovarian cysts, and I've had cyst drain before. I kind of went through that phase of like kind of the typical thing we hear of women saying like, I had this pain for so long and nobody believed me type thing. And so when we did this ovary mobilization and it was so incredibly painful for me, that should not be that incredibly painful. Ovaries are tender, but they should not be like you are about ready to lose your cool. And I lost my cool. And luckily, well, Dr. Yenny came over for you too, Roxy. She came over and did some work, and it released a big emotional letdown, a big emotional release. I was like crying, sobbing, but laughing. Couldn't figure out really why I was crying, but I just kept saying, thank you. And then afterwards, even after leaving that and telling my husband about it, he was on that trip crying and tearful, talking about it too, because it was just crazy. And it was like such I'm very thankful that I had that experience because we learn, I mean, when we have a lived experience, it definitely helps us with our patients. And then Roxy, I know you kind of had a similar one.
So Megan told me about hers and I was like, oh, dang, that's weird. Not weird in a weird way, in a bad way.
It is weird. Like you don't think
like, huh,
yeah.
Okay.
I know.
And so then, I mean, like we were talking about my peritoneum was just so uncomfortable, that right lower quarter. I don't know what it is about our right ovary, girl. Like,
I know.
just have some dead right ovaries. I don't know. It was like so tender the whole time. And so then they were going to do this ovary reset on me where you kind of like find them and then push. And I was like, Megan, I don't think I can do this. It just is so hurting. And people have been finding my ovaries, hunting on my ovaries all day. And I just was like, this hurts. And so then Dr. Yeni came over and same stinking thing out of nowhere. She's like pushing and she's like, okay, I'm going to do it. And I start sobbing, and I have no history that I know of, like nothing. Like, I don't know. I don't know where it came from. So it really threw me off because I was like sobbing. Like Megan said, I was sobbing and laughing, and like, it was just so intense.
So weird.
So weird. And then, she stopped and I just like looked at her in the eyes and my tears. I was like, thank you. Like, it's like, I knew I needed something fixed, evidently. So anyway, I don't know. Well, I literally can't. I don't have anything to like try, like pin it to or like connect it to, but it was so weird. And I'm usually not like that. It's just atypical.
You're postpartum. So that's where I would
Yeah.
say, yeah, like you maybe didn't have, but like you did post
Yeah.
fairly. I mean, really in the grand scheme of things, fairly postpartum, but
Yeah.
still, yeah, it wasn't like you were anticipating that. And it was really wild for you because it was so right-sided.
Yeah.
Oh,
So weird.
we need to get back together and do some more of this stuff on each
Yeah.
other.
You want to work on me?
Yeah, I do. It's like, let's look at our calendar. And then like maybe we just need to like open up a schedule and be like, all right, everybody, you get 15 minutes. Let us find your ovaries and then you're out.
Yeah.
That's how you get good, people. You just keep trying it.
Hunting, ovary hunting.
Ovary hunting, fundus finding. Okay, so let's see here. Do I have anything else left in my notes to talk about?
We hit it all.
I think, I mean, we really hit it all as far as like the treatment goes. And then of course, like we're also going to treat what other things we find. So,
pelvic floor.
Pelvic floor, hip tightness, back tightness. We treat, quite a bit through the spine, helping with reset of nervous system, improving rib cage mobility for breath work, that sort of thing. So, and then of course, when we're doing the peritoneum work, the cool thing, like when people are like, oh my gosh, I feel it up in my throat, then I'm like, all right. Anterior line is tight as far as fascial work goes. So sometimes we might uncover some of that and work on that too. Because really, ultimately, like we just want to get your body in like the healthiest, most optimized place it can be in when you're trying to get pregnant. So yeah, cool stuff. So if you guys have any questions on any of that, feel free to send us a direct message or go to our individual websites and submit requests depending on like where you live, whoever's closest. Even if you're not local to us, we both do virtual consultations. So definitely something that we can chat about. Okay, so that wraps up kind of like a rundown of our pelvic rehab fertility specialist certification. And now we've just been focusing on working with our patients and perfecting our craft. And if anybody listening to this is going through infertility or endometriosis or PCOS or anything like that, like please feel free to reach out and ask questions. And even if you're trying to find a provider in your area, we're always happy to try to help you in doing that. We have a lot of colleagues around the country that are some of the best. So happy to help. Anyway, Roxy, any final words?
I just think too, I think knowledge is power. Mm-hmm. And so even if you're not in the fertility world, you never know who you're brushing shoulders with or who's close with you that, just needs to kind of know or have ideas or encouragement or whatever too. And so even if this never affects you directly, I think it's just good to kind of have an idea.
Yeah.
Help a friend or whatever, just suggest it because it's not always the common knowledge or the first route of the fertility journey. And so good.
And I think with that, like you just said, I think that's a really good reminder that our place in the pelvic health or our place in the fertility space as a physical therapist is still so new that a lot of providers, it's not their first thing to think of. So like Roxy just said, you don't ever know who you're walking by, and that if you've listened to this podcast or you know about it, to be able to share that with other people, because often this like being told there's nothing else we can do. If this hasn't been done, then that is something else. And there is further investigation that can be looked at. And we are not claiming to be the end all be all by any means, but we just know that this is consistently very helpful for individuals. So, okay, well, we're looking forward to our next episode, moving on to some other fun topics. We haven't fully decided, but like we're maybe some more personal stuff, switch gears a bit. And who knows, maybe we'll talk some business talk coming up. But let us know on our Instagram. If you have any topics that you want us to talk about, please feel free to let us know. And as always, we appreciate any likes or reviews of the podcast. And we are just glad to continue the conversation. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.